Welcome back to Save Your Thyroid with Jennifer Holcomb, the podcast where we explore the latest advancements in thyroid care and patient advocacy. Thyroid nodules affect up to 70 or 80% of adults, and the most common tool doctors use to evaluate these nodules is ultrasound. But not all ultrasounds are the same. Traditional 2D ultrasound has been the standard for decades, but it can have real limitations. It might miss important details about the size, shape, or structure of a thyroid nodule. And that can directly impact your diagnosis and treatment plan. Today, we're talking about how new 3D ultrasound technology is changing that, giving doctors a clearer, more accurate view of the thyroid and helping patients get better answers faster. Joining me today is Dr. Alireza Falahati, a Mayo Clinic trained, board-certified endocrinologist with a specialized focus on the diagnosis and treatment of thyroid and parathyroid tumors. He's the president of Utah Endocrinology Associates and founder of Salt Lake City RFA Clinic, where he's been managing thyroid disorders and nodules for over 20 years. A pioneer in interventional endocrinology, Dr. Falahati is one of the few physicians in the world to offer all three minimally invasive treatments for thyroid nodules: radiofrequency ablation, microwave ablation, and nanosecond pulse field ablation. He was also the first U.S. physician to implement the advanced 3D ultrasound system by PIUR Imaging, which we'll be talking about today. In this episode, we'll cover why traditional 2D ultrasound isn't always enough, how incomplete imaging can lead to unnecessary procedures, how 3D ultrasound technology gives doctors a clearer view of the thyroid, and how you can advocate for better imaging and take charge of your thyroid care. Let's get started. Dr. Falahati, welcome back. It's wonderful to see you again.
Good morning, Jen. It's great to see you as well.
Many patients assume that all ultrasounds are the same. So how does the traditional 2D ultrasound work?
Great question. The traditional 2D ultrasound is a cross-sectional imaging method where we look at two-dimensional images, meaning slices through the thyroid tissue in a way where we then measure different dimensions of the object that we're measuring and looking at. And based on our experience, whether it is personal experience or collective experience, we have come up with some formulas and ways of measuring those nodules' volume and make clinical assessments. Now, there are significant limitations when it comes to this 2D imaging. And one is you literally are depending on the operator to decide which dimension and from what point to measure. As you can imagine, a nodule or a thyroid gland or any organ is a three-dimensional structure. And to choose what two reference points to use is kind of not very accurate and precise. And specifically, it's not exactly reproducible. So that's definitely the major limitation of the 2D ultrasound.
We're talking about making 2D images of a 3D object. So you're not able to see the entirety of what you're looking at in two dimensions if you're looking at something that is spherical or three-dimensional. As you said, it's very operator dependent. Say one physician looks at a nodule and has an assessment of it, and they have more experience. But then someone, maybe an ultrasound technician in an imaging center, has less experience and might not understand exactly what they're looking at and properly evaluate it. Let's talk about the challenges when we're comparing these ultrasounds over time for someone who's managing thyroid nodules.
When we look at a nodule, we look at its appearance and its size. And especially in larger medical centers, academic centers, most physicians do not have access to the ultrasound device themselves. And they are totally dependent, as you mentioned, on the technician and technician's judgment of what two reference points to use to measure that specific dimension. And keep in mind, let's say we are doing serial images every 3 months, every 6 months. And the odds of the same technician measuring the same nodule are very slim. So we are talking about multiple people looking at these images, and every one of them, it's a judgment call. They decide, okay, so this would be a good reference point, and I'm going to measure it from here to here. So you really will be looking at so many different images that do not even look alike, and you are at the mercy of that individual technician in terms of, is this now an accurate measurement of this tumor that I am assessing? And based on that, I am deciding, should I treat that nodule or surgically remove it or not? Is it growing or not? Do I need to biopsy that lesion or not? All of that based on somebody's assessments that may or may not be accurate. Now, let's say best case scenario, you yourself are the operator. And like at my clinics, I do the ultrasounds myself. And let's say I see the patient again periodically. The odds of even I measuring exactly the two same spots or same images are very slim. It's technically impossible because the nodule changes and it may grow in one area, which is not necessarily the area of measurements by me. And I would be missing that part of the image. Now, if you're talking about measuring the ballpark of a mass or lesion, that would work. But when it comes to precision, especially nowadays, we are moving so fast in the direction of making quick clinical decisions to treat the patients with all these amazing treatment options we have. We really need to have precise, reproducible images that can be relied on rather than depending on human judgment and human error.
It's my experience as a patient who's undergone 2 radiofrequency ablation treatments that everyone's opinion is going to be different and that the assessment of the nodules is highly subjective. And so I think that that consistency and precision is very important, especially when tracking over time. Have you ever encountered a case where a patient's condition maybe was misdiagnosed or delayed because of these limitations?
Absolutely, yes. And, I see that almost on a daily basis where either I perform a procedure on a patient and I send them to a radiology department for follow up because they are remote or they are far away from me. And I depend on their reports. And their reports and them not being familiar with sometimes the procedures I do. But regardless of that, even an objective report is lacking here because the radiologist depends on his technician, and the technician measures something and they suddenly significantly underestimate or overestimate the size of the nodule. And then I bring the patient back and ask them to drive 200 miles to me for another measurement. And when I look at it, I'm like, what are they talking about? Really, we are on track with our treatment response and everything is going well. And those reports were far off. So I see that almost every day. But also, I have seen patients where I feel the nodule on exam. Then I look at the report, and the report says perfectly normal thyroid ultrasound despite an enlarged thyroid. And then the question is, what are they missing? And when I do the ultrasound, I see, oh my God, there is a 7 centimeter tumor, and the technician was just zooming on the tissue inside the nodule and thinking, wow, this is a smooth, normal tissue, just enlarged. So they are standing in front of the elephant, looking at the big elephant, and they say, well, there is no elephant, there's just a gray wall. That was very, very interesting to see. And that was reported by a very reputable radiology department. Again, back to trying to come up with ways of becoming more objective and moving away from that subjectivity would be ideal.
We've experienced the same thing with patients in the Save Your Thyroid community as well, where they had their physician who treated their nodule give them a different assessment of what their nodule's status was. And then someone in a local physician office or imaging center gave them a completely different assessment. And so it causes a lot of anxiety for the patients as
Absolutely.
well. I feel like this would be a really wonderful way to limit that as much as possible. So let's get into the advantages now of the 3D ultrasound. Can you explain how does the 3D ultrasound solve some of these problems we just discussed?
I have been using the 3D ultrasound now for a while, and what it provides me with is the reassurance. Sometimes I still do my own measurements, but I compare it with the 3D ultrasound to just make sure consistency is there. And what I'm finding out is that 3D ultrasound really saves me time. So if I would get to the point of completely moving away from 2D ultrasound and do just 3D ultrasound, I would be able to save lots of time, because literally the way the technical aspects of it work is basically you put your probe at the bottom of each thyroid lobe and slowly sweep it up, and you're done with that lobe, and then sweep it up again on the other side, and then you're done. And the software and the computer does the rest of it. You get to also look at it, and if there are any minor shifts in the lines that you would like to see or the landmarks, you can adjust them, but most of the time you don't even need any adjustments, and you have a beautiful 3D image of the structure you're looking at. Not only that, the volume calculation is there, and that is based on the actual volume of the object that you're looking at, whether it is a thyroid lobe or a thyroid nodule. It also literally, you can take that image, turn it around, and look at it from different angles to get a really good feel for what does the nodule look like, where is it at, kind of in terms of its distance to the capsule of the thyroid, etc.
Mm.
But also it gives you the assessments of, from radiologic standpoint, in terms of risk of malignancy based on TIRADS criteria. So you really get the recommended TIRAD scores. You get a much more accurate image. And those irregularities we see in the structure of some nodules, because not every nodule is exactly oval shaped or round. And
Mhm.
sometimes one corner of it is extending or differently shaped. And you get to see all of that on this 3D ultrasound. And what I love about it is the reproducibility of this image and these measurements. So you can literally bring the patient back a few months later, measure, and you can compare. And if it says there is a size difference, you can really rely on that.
What 3D ultrasound system do you use in your clinic?
So I'm using the PIUR Imaging system. Their current software or equipment is called Infinity. And it is a very ingenious concept. Instead of us buying and God knows how expensive ultrasound system that may or may not have certain features, this unit, it comes in a small box that you connect to your ultrasound device. It takes the images or the feed from that ultrasound, and also you have a little sensor that you put on your ultrasound probe. So as you move the probe in different directions, the system knows exactly what the position of your probe is. So that way it helps it to assess the nodule and the images much more accurately. All that information is sent to a laptop or a computer that is connected to that box. So now you have all those 3D images on that computer ready to go with a beautiful report. And all the 3D images are also incorporated in your report. So you have a very nice report that has the images, the measurements of the thyroid lobes and of the entire thyroid gland, as well as of the nodules. The nodules are also color coded based on the risk of malignancy, which is
Wow.
fascinating. It really, if I stick to that and not do my own ultrasound on the side, I can really save a lot of time, because literally
Yeah.
sweep, you're done. And the accuracy that you gain from it, and the fact that you can really now compare apples with apples, literally is of huge advantage in my opinion.
That's interesting when you think about the time aspect. My
Yeah.
last ultrasound took a long time because my doctor had to go through and individually measure every single one of my nodules because I have several. And I've had one of them ablated twice with RFA. And so it's not completely straightforward measuring that nodule. And especially for someone who maybe was not involved in that ablation, it takes even longer for them. And so taking that process that may take 30 to 45 minutes and shrinking it down to a matter of minutes, that's just incredible.
So when I do a 2D measurement of an ultrasound, I start usually with the individual thyroid lobes and measure the thyroid gland first. So I measure the three dimensions of that nodule, followed by moving on to the opposite side, and then the isthmus that connects left to right. And that takes a while. And then I have to zoom in on individual nodules and again measure the three dimensions of each nodule. That takes also some time. And then transferring those measurements into a report, that by itself is also another time consuming process. This is after the ultrasound is done. Whereas with PIUR imaging, I literally, after everything is ready to go and I put the sensor from PIUR imaging on my probe, I turn on the device, I connect the device to my computer, I'm ready to go. And I literally hit start and start scanning one thyroid lobe and then stop, and then move on to the opposite lobe, start, and then stop. And that's all I do. And the rest of it is done by the software and the machine, where it literally gives me all the relevant measurements very accurately. So I get the volume and all three dimensions of the thyroid lobes, as well as the individual nodules. It's literally just needs my confirmation that I agree with the assessment of those nodules to finalize the report. So literally I scan, I look at the report, agree, confirm, and it's done. I get a beautiful report that I upload into my patient charts, and I'm done.
How is this giving you more confidence in assessing nodules, whether if they need surgery, biopsies, or any other kind of treatment?
Knowing that I am looking at every angle of this nodule and not just three images or two images measuring three dimensions, but looking at the entire nodule and every corner and every angle of it gives me confidence that I am making a better decision in terms of how to treat this nodule and what to do about it. But also in terms of follow ups, now whether I treat or not, let's say for some nodule that I'm really on the fence in terms of treatment, and I would like to wait another 2 or 3 months and do another image before I make a decision. Now, if I do this measurements by using the 3D ultrasound and get the new report, I can reliably compare it with the previous one. So it either convinces me to move forward with the procedures that are necessary or keeps me from being too aggressive and making the wrong judgment call and move forward with something that was not necessary.
How will this help patients get a faster or more accurate diagnosis?
I think the time spent on the technicalities of this imaging is much less with higher accuracy. I mean, what else can we ask for, honestly, as thyroidologists or as people who deal with thyroid nodules? It's just an amazing concept where you have a system that you can rely on. It lowers your anxiety, and also it passes on to the patient. It gives them the reassurance that we are really looking at what is relevant reliably and objectively. And if anything is recommended by us, then the patients can rely on with a lower anxiety level of wondering if it is accurate, it is reliable or not.
I would imagine that definitely helps them to really understand better their condition and their treatment plan and the results of their treatment, especially
Absolutely.
when you've had a nodule that's been shrunk by a certain amount and you can actually see there is my nodule, it's decreased by 30%. And rather than trying to understand and conceptualize that abstract percentage of reduction, you're actually able to see it side by
Exactly.
side. So that's really
Exactly.
cool. So let's talk about what patients can do regarding accessing this kind of technology. They may not even know that they have options beyond traditional 2D ultrasound. So what can they do to advocate for better imaging?
As you know, Jen, this is a very new concept, and we are stepping into a new era of ultra smart technologies entering the ultrasound market and providing us with all these benefits. And at the end of the day, the beneficiary of it are the patients. So they need to be involved and they need to be informed and really ask the right questions. So if they go to a doctor and they are diagnosed with a certain condition, whether it is one single nodule or multiple nodules and or just enlarged thyroid, and they discuss treatment options, I think they have the right to ask the doctor if those measurements are really reliable and accurate, and actually challenge the doctor, asking them, how reliable are your measurements? If you measure my nodule 3 times back to back, are you going to measure this, get the same measurements exactly,
Hmm.
or are they going to be different? And also, the other part is it depends on their individual situation. If their nodule size or appearance is so borderline where a decision needs to be made whether or not to do a certain treatment, but they are so at the border to normal versus abnormal, they should definitely insist on getting a 3D imaging. And I am sure there are plenty of resources, and also companies like PIUR Imaging will be able to provide a list of physicians who are using their technology. That would be one place to go, maybe, and search for doctors using certain software and technology, or just ask the doctor directly, I would like to find out if these measurements are accurate, and I would like to go to a place where 3D ultrasound is being performed. Now, on the other hand, if you're talking about a gigantic nodule that is so large that is beyond and above being borderline,
Hmm.
then they may be okay with just staying with the traditional 2D ultrasound and not cause any further delay.
But those borderline patients, as you mentioned, that's really important. I would like to highlight that again, because we see patients in the community all the time who say, my nodule has grown 3 millimeters in one direction, and that's causing
Yes,
them a great amount of anxiety. I tell them all the time that can be operator dependent, that could be based on
absolutely.
how much pressure they're applying to the thyroid gland with the probe. It can be the difference of the brand of the ultrasound machine.
Yeah.
It can be dependent upon so many different things. And so I always encourage them to not let these tiny little millimeter, increases in size give them so much anxiety. Now, I understand with thyroid cancer, it's a little bit different and that we have to be a little more aggressive in tracking these changes. But even then, you still have to consider the subjectivity of the physician who's doing the
You
ultrasound.
are 100% correct, Jen. And especially when it comes to conditions such as thyroid cancer, every millimeter counts. Literally, if I move my probe by 1 millimeter to the left or to the right, I get two different measurements. And that may affect my clinical decision making. Especially nowadays, one new approach to thyroid cancer, as you know, is active surveillance.
Hmm.
Active surveillance is basically the concept of wait and watch. And wait and watch what? If you have no accurate way of measuring it, how do you know that there is a progression or not? If you do not have the means and do not have the really reliable, accurate way of measuring the lesion in many cases, then how can you just wait and watch? Even that category of treatment, because now we have treatments with kind of in terms of thyroid cancer, surgery, radio frequency ablation, microwave ablation, and on, but also active surveillance. You can only do active surveillance if you have a really reliable way of monitoring those.
Any final thoughts on 3D ultrasound versus 2D ultrasound today?
I think it's a beautiful era to live in and to practice, or to be a patient even, because we are starting to see technologies that are really groundbreaking. I was very impressed when I first met the staff at PIUR Imaging in Europe and was introduced to their concept and to their system. And since then, their system has evolved even significantly. But it's just exciting to be to practice at a time where you have these amazing technologies and these brilliant people working constantly on improving the accuracy and precision of these images and measurements. So the more accurate the diagnostic tools are, the more we can rest assured that we are making the right decision. So I think it's just an amazing time to be in, and I am very grateful to people like the scientists at PIUR Imaging who are constantly working on advancing and pushing the boundaries.
Thank you so much, Dr. Falahati. It's been an absolute pleasure chatting with you today. That wraps up today's episode. If you found this valuable, please like, subscribe, and share it with someone who might benefit. You can find links to everything we discussed in the show notes below and on my Substack, It's Me, Jen Again. Find a physician, discover treatment options, and join our patient community at saveyourthyroid.org. Please remember this podcast is for informational purposes only and is not a substitute for professional medical advice. No endorsement is given or implied for any specific product, treatment, or physician mentioned. Always consult with a qualified healthcare professional for your individual needs. Thanks for listening, and I'll see you next time.